Hello, my name is Dr. Diwan S. Raja. Today I will discuss about the calcaneal tendon, also called Tendocalcaneus, also called Tendoachilles. Okay, so all three are same structure, and this structure is present at the back of the leg. Okay, so this is present at the back of the leg. Okay, so Tendoachilles, according to the Greek legend, there was an invincible warrior, undefeatable, because his mother was the goddess of sea, and she held her son by the heel and dipped into an underground river water, okay, that is called Styx. And this person was a great warrior, and he was impenetrable, invincible, but he died in the war of Trojan because his heel was not came in contact with that of the water, so it was vulnerable, and he got arrow there, and those arrows killed him. Okay, that is the legend, Greek legend. We have to go through the Tendocalcaneus, calcaneal tendon, and the Tendoachilles. This is present at the back of the leg, so this is the Tendoachilles. Tendocalcaneus, calcaneus, also called Tendoachilles, and it is about 15 centimeter in length, and this is the strongest and widest tendon of our body. Okay, it is the strongest and the widest tendon of our body. Okay, we got the Tendocalcaneus, its location, and this is the tendon. This is the tendon of the Triceps Surae. Okay, the Triceps Surae is composed of two head of gastrocnemius, two head of gastrocnemius, and soleus. Okay, so that is the Triceps Surae. So this is the tendon for Triceps Surae. So we have the medial head of gastrocnemius, medial head of gastrocnemius, okay, and this is the lateral head of gastrocnemius, okay, so we got that. We have another muscle here, that is this is the plantaris muscle, that is not a part of Triceps Surae, but it is related to the lateral head of gastrocnemius. It is very small muscle, and its tendon is very long. It may be inserted with this tendon, or maybe in front of this to the calcaneum. It may be absent in some individual, around 10 to 15% individual. This is the plantaris muscle. Plantaris, it may be absent. Okay, it may be inserted to the calcaneum separately or may be a part of the Tendoachilles. Okay, so we got the Tendocalcaneus is length. Now we have to know that the muscles here, medial head of gastrocnemius, lateral head of gastrocnemius, and this is the soleus. Another part here, soleus. Okay, this is also soleus. Soleus is present deep, gastrocnemius is present superficial, and our tendon is wide above and it is narrow below, and then it is wide in the lower part. Okay, so that is the Tendoachilles. So it is wide above, then it is narrow, then it is little bit wide again. Okay, where it inserts. So you can go to the extension of the Tendoachilles. Okay, it extends from the middle of the middle of the leg to the middle third of the posterior surface of the calcaneum. Okay, calcaneum. This is the calcaneum. This is the posterior part. This is the middle third of posterior part. This site of insertion. There is in the middle third of the posterior surface of the calcaneum, the bone at the foot. So starting from the middle of the leg, going to the heel here, and this is the calcaneum bone on the posterior surface of the calcaneum, and on the middle third of the posterior surface of the calcaneum. Okay, we have to know this insertion area is related to two bursae. Okay, we have two bursae. One bursa is between the bone and the tendon, another bursa is between the skin and the tendon. We have deep bursa. Okay, deep bursa between the tendon and between the tendon and the upper part of the calcaneal posterior aspect. Okay, so just above where it is inserting, just deep to that, just above that insertion area, we have a bursa, a deep bursa. We have superficial bursa, that is between the skin and the tendon. That is okay, between the skin and the Tendoachilles. Okay, we got two bursa. One is just between the tendon and the bone, another is between the skin and the tendon. Okay, we got two bursa. So now we'll go to, this is the structure. So histologically, this is a tendon, so it is a connective tissue. It is a regular connective tissue and it contains collagen fiber. Okay, contains collagen fiber. Okay, so it contains regular collagen fibers. We got histological feature of the tendon. Okay, now we'll learn some clinical anatomy. Okay, before going to the clinical anatomy details, we must know what is the purpose of Tendocalcaneum. So, what is the function of Tendocalcaneum or Tendoachilles? Functions. Okay, what are the functions? First of all, it is very important muscle for the plantar flexion of the ankle joint. Okay, so plantar flexion of the ankle joint. Okay, this is very important. So it is the most important tendon for walking, running and keeping the erect posture. Okay, for walking, running, okay, and standing on the toes and standing on the toes. Okay, so we got the function, and now learn the clinical anatomy. What are the problem may come? Clinical anatomy of the Tendoachilles. Okay, so Tendoachilles may be ruptured. Okay, ruptured due to overuse in very much unconditioned person, maybe with aged person. Suddenly people may be involved in very much strenuous physical exercise, running without conditioning. So there may be rupture of the Tendoachilles. Okay, that is a possibility. And there may be cut. Cut may be some type of accident like that of hurricane or cyclone or typhoon. Some sharp object may cut this part, or it may be due to violence. Okay, accident or violence, that may happen, rupture, or it may be ruptured due to some type of tendinitis. Rupture due to tendinitis. Okay, now it is blamed that one of the antibiotic, ciprofloxacin, may cause tendinitis. On rare occasion it may rupture the Tendoachilles, the antibiotic ciprofloxacin. Okay, so maybe by drug like that of ciprofloxacin. Okay, on rarely it may rupture, rarely ruptures, but there is a possibility of rupture because there is possibility of tendinitis. Okay, so we got the what will happen if a person has rupture of the Tendoachilles. Then person cannot stand on the toes, person cannot run properly, cannot walk. The plantar flexion will be almost impossible because plantar flexion depends on this tendon and the gastrocnemius and soleus muscle. Soleus muscle is deep to the Tendoachilles. Okay, so it is deep to the gastrocnemius and it is inserted deeper part of the Tendoachilles. So gastrocnemius soleus will not work. So plantar flexion is impossible, and a person may fall forward due to bilateral damage to the Tendoachilles. Okay, we got that. Then another important point is that this area is a site to test the nervous system. So we have a jerk, we call it ankle jerk or ankle reflex, ankle jerk or ankle reflex. Okay, so if we take this part, if we tap this part by a tendon hammer, okay, so tapping by a tendon hammer, okay, so we look at the movement of the ankle joint, okay, so we can test the spinal cord S1 and S2, okay, test for S1 and S2 segment of the spinal cord. Okay, we got the ankle jerk or ankle reflex. Another problem may happen that may be symptomatic, may not be symptomatic, may be asymptomatic or symptomatic. There may be spur formation, calcaneal spur, a bony extension from the calcaneum may go along the insertion going up, a small bony spur that may happen. It may be symptomatic, may be asymptomatic. It may be a complication of microtrauma due to bad shoes or tendinitis, or it may be a part of degenerative process. And that's all about the Tendocalcaneus. If you like my video, please support my channel. If you have any question, please feel free to ask me. Have a nice day. Bye now.